Hi everybody. In this video, we are going to start looking at different techniques that we use during wax modeling. One of the things that we use, especially when recreating features, is an armature. An armature is defined as a support or a framework for wax restoration. And there's different things that you can use as armatures. There are splints. Splint would be like a piece of wood. I've used a splint before to help recreate a nose a little bit. Just use tongue depressors. That can be used as a splint. Wire. The wire in this case, I've actually used chicken wire in the past. It's very malleable. You can mold it, and you can pack wax into it. So it actually works pretty well as an armature. Plaster of Paris, not the greatest of armatures. Though it will hold a shape, it will also suck moisture out of the wax. And so the wax will crack and not last as long. So I wouldn't suggest using plaster of Paris for an armature. As a filler or a binding agent, sure. Cardboard, again, not the best because if it gets wet, it gets mushy. Pliable metal, I've known people that said they've used tin foil. Again, I prefer the chicken wire over that kind of thing. And sutures, and there's one suture in particular that we use for what we call deep wound excision. And that suture is called the basket weave suture. The basket weave suture is made at the perimeters of the cavity, okay? And it's pretty simple. You just kind of go in through the skin, go across, in through the skin, go across, in through the skin, back and forth, and then when you go back this way, you actually interweave it in between those first sutures that you did. So these cross stitches are made in the margins of the cavity, and that allows, it does actually two things. One, it keeps the margins of this cavity where they're supposed to be, but as far as an armature goes, we can then pack wax into that ligature and it will hold it. That the wax will kind of surround the ligature and it will hold it in place. Really good to use if you're using firm or wound filler wax because that doesn't stick very well. We'll talk more about the basket weave suture later. Now we're going to look at size, position, and form of any reconstructions that you might be doing. And we've mentioned this once before, but size is the most important modeling parameter. Okay. Some people say proportions. Well, this face on the right is perfectly proportional. The eyes are proportional to the nose, which is proportional to the mouth, but they're not the right size, right? So you can have perfectly formed, perfectly proportional features, but if they're too small or too big, then it's not going to look right. And if you remember when we talk size, we say length is the vertical measurement, so up and down. Width is the horizontal measurement, side to side. Now related to size somewhat are projections, the nose being the most prominent. Projection is just measurement of an extension of any part past its surroundings. One of the ways to see this would be from a profile view. Remember we talked about profile view should always be the view that you start with, but the problem with that is that we don't tend to have a lot of profiles of people in pictures. And so it's kind of tricky sometimes to figure out what the proper projection is. Well, as I said, projection kind of relates to size a little bit. So if we interpret highlights and shadows, so for instance, the shadows on this girl's nose, the shadow onto her cheek where there's a little bit of highlight here, but there's a shadow of her nose. If I'm trying to recreate her nose and I get the right size, then these shadows and highlights should match up to whatever the shadows and highlights on a picture are. One of the things when doing this, though, you do have to interpret where the light is coming from. So for instance, in this picture, the light is kind of coming from this way. And so you'd want to light the face from that way so you could line up the shadows and highlights. Next aspect is position. That's the spatial relationship of features. If you have the right proportions, then you should come up with the right size of the feature that you're trying to recreate, but you can also use that to determine the right position. So there's lots of ways of doing this. If we use classic proportions, for instance, we know that the nose is one eye wide, and that's kind of centered into in between the two medial corners of the eye. The mouth is 2 eyes wide, and so it's kind of an eye on each side. The ears can be placed using classic proportions. So the bottom of the ears tend to line up with the bottom of the nose. The top of the ears tend to line up with the top of the eyebrows. We can use bones. But again, if you have the wrong size, then your proportions will be off. And your position will be kind of off too. So it's important that you look for where those positions are and where they probably should be. Bone structures, as I mentioned, can provide infallible guides to position. Bones don't change, tissue can. Bones tend not to be. And lastly is form. Form depends on knowledge of structural relationships, which basically just means that you know what parts go on something. So like, for instance, an ear. Well, you can have an ear that kind of looks like an ear, but if it's missing an antihelix, or it's missing a helix, or it's missing a lobe, that's not going to look right. It'll look close, but it's not going to look proper. You also have to be very objective. This is probably the hardest part. You hear it in lab all the time, but I really like this ear, but it's a bad ear. Okay, it's not that good. You have to be objective. You have to look at it at your work and go, yeah, that's not right. I need to start again, or I need to change something. And it also does depend on manual coordination. I mean, some people just aren't good at this, and that's okay. That's not a problem. Some people are better. Some people have a natural knack for it. Some people don't. But it also helps to practice. Now we're going to talk about the roughness of your formative work. So in your initial modeling phases, you should really be focusing on getting the right dimensions. So size, again, we say size is the most important. When you're starting to make your wax heads, for instance, and you start to make a nose, well, don't worry about what the nose is supposed to look like right away. Worry about the size, okay? Because again, you could have a perfectly formed nose, but it's too big. So make sure that the dimensions are proper. Worry about smoothing and detail after the proper dimensions have been reached. Smoothing can come later. You want to make sure that the size is correct, especially when you hand in your wax heads, because one of the things I grade on is the size. Do you have the proper dimensions? That's a pretty big chunk of those 50 points that come from your wax head. And the last part in this video we're going to talk about are the views, the modeling views. Mainly we're going to look at the profile, bilateral, and the direct views. So profile, they say, is the most important view. This is the modeling view that you should begin your modeling with. The view you should begin with, because this shows proper projection. Okay. Now again, the problem with this is that most of the time we don't have pictures that are of someone's profile. If you're lucky enough, that's good. Now, one of the ways that you can figure out what the proper projections should be is that if you measure from two different directions, okay? So you measure from this line, okay? So you always want the same frame of reference going down. Oh, my mouse went off. Okay, so this line and this line, those are your frames of reference. If I use that as my frame of reference, I can go down to this projection and it goes out this far. Okay, so it's this far down and this far out. Okay, this next projection, it's this far down and this far out. Okay, so if I know those, then I can figure out, and you can do this all the way down. I mean, you can go from here, you can go to here, you can go to here, you can go to here, and here, and here. And what that will do is actually create an outline for you. Okay. So if you get a picture, again, you can graph it out to where these projections and where these recessions should be. The bilateral view is the second most important view. Again, this can be either a superior bilateral view or an inferior bilateral view. This is the view that people get when they approach the casket. That's that inferior bilateral view. This one, pointer, this one here. But why this is important is that this shows the lateral curvature of the features. If you remember, the forehead, the cheeks, the upper lip, and the chin all tend to have the same bilateral curvature. Okay, so chin, upper lip, cheeks, forehead. And this can also show some asymmetry of features, though this is not as good at seeing asymmetries as the direct view. So the direct view is the view that we would probably most often have. Now, when we talk about the direct view, the inverted direct view is actually pretty helpful. This helps to review details that we would maybe overlook while we're looking at a face, because we come with our own preconceptions of what a face should look like, what a nose should look like, a mouth, eyes, ears. Flipping it upside down, then you just tend to see shapes. This can also help you to focus on one individual region and not a face as a whole, which can be helpful by just focusing on the nose, not the nose in relation to anything as of yet. That can help me to form it properly. Now, this inverted direct view is also a view that we have a lot in the prep room. So if we stand at the head of the embalming table, we would get this inverted direct view. And again, it kind of tricks your brain into seeing shapes, not noses, not mouths, not eyes, not ears. And lastly, in this video, the changing of your views while you are doing modeling. It is good to constantly change your views. So not just doing everything from a direct view. You want to do things from a direct view, then a profile, then bilateral, and keep switching your views because you're dealing with a three-dimensional object. Okay, by constantly changing your views, keeps your eyes from getting tired, and when your eyes get tired, you get headaches, and then you want to go to sleep. But it also helps to keep that surface more accurate, because again, I'm not just doing things from a profile view, or a direct view, or a bilateral view, because it will look good from those views, but then you take another view and it's all wrong. Another thing that you need to do is step back. Step back and look at what you're doing from a distance. So distance viewing is very valuable because you can focus on a feature so closely that you don't see it in relation to the rest of the face. And again, that can be kind of helpful to a point, but you got to make sure you're putting it in the right spot. So views that are constantly very close can't show you overall form faults. So again, I might be focusing on this nose, and I'm like, yeah, that's a perfect nose, but it's in the totally wrong place. Okay, so distance viewing is pretty helpful. Step back, take a look, and be objective. Okay, so that finishes it for this video. In the next video, we are going to talk about finishing touches on waxwork.